Wild Health is about optimizing you. We use genomics, blood work, biometrics, microbiome assessment, many other tests, and a conversation with you to come up with a full health optimization plan. What's the perfect diet, exercise, and supplement plan for you and only you? The Wild Health podcast is about optimizing all of us. Here we cover the cutting-edge science that gives you the base to be able to apply the personalized plan we give you as a patient. To sign up as a patient, go to wildhealth.com. Or if you're a physician or health coach and you want to learn how to do this for your patients, we're happy to help as well. Wildhealth.com for all the information on becoming a patient or working with us. Bjoern, it's great to have you back. Thanks for joining us again on the Wild Health Podcast.
Wonderful. Thanks, Matt. Thanks for having me again.
For sure. I think it was about a year and a half ago or so when we first had a podcast about Katalyst. And at that time, I had just gotten a suit. I was pretty novice with it. I was using it incorrectly. You were correcting me on all the ways I was doing it wrong. But I was just, at the time, novice with it, but shocked at how I was feeling and the results that I was getting personally, and was just interested in digging in and hearing from you more about it. Things are different now. A year and a half later, I've probably gained 10 to 15 pounds of muscle on it. I have a lot of experience with patients who are getting really good results with it. I find myself talking about it a lot and recommending it a lot. And whenever I find myself talking to individuals over and over about something, it makes me think we should probably do a podcast about it and talk to a lot of people at once, because I think there are a lot of benefits to this. Now, what I'll say is, if you didn't hear the first podcast, go back, because I think we're not going to go over those basics of necessarily what is EMS, what is the Katalyst suit. We'll talk about it very briefly, but I want to get into some specific questions, because after that episode, we get a lot of questions about it, and I want to address some of those. Also, I want to address questions that I get personally frequently about it, and just what come up in practice. So if you don't mind, maybe just start, instead of giving your full background, because we'll link to that old episode, just maybe 2 minutes on why you started Katalyst, what it is, and then we're just going to jump right into the specific stuff.
Of course. So about 12 years ago, I had a job in tech where I had teams all over the world, and I sat about 150 days a year on a plane. And 15 years earlier, I already had a career change because of my lower back issues that I had. So I have very narrow discs between L3, 4, and 5, and scoliosis around there. So sitting for extended periods of time around in a plane got me to like massive agony and pain. I was on painkillers 20 days a month. And my physician said, we either gonna have to operate probably in a year and a half, or you quit your job, or you massively strengthen your core. And I was like, I don't want to get operated on, and I also don't want to quit my job. So what's the alternative? And he said, I personally go to a studio down the road and they use these suits and you train. And I was like, what the hell are you talking about? And he explained it to me, and he said, like, we normally use electro-stimulation technology to rehab local areas of the body. We've been doing this for 60 years. Here they have put it into a suit, and the suit then intensifies your muscle contractions while you're going through basic calisthenic motions. And I was like, interesting. So I tried it out. I was sore for days after the first time, because this hit muscles and muscle groups that I didn't know I had, or were dormant or super weak, and especially around my core. And once a week, every Monday, I went. 6 weeks later, I woke up in bed and I told my wife I haven't taken a pill in a week. And I was like, this is amazing. This is a miracle. And kept using it. Trained every Monday besides a 60-year-old female, which, for context, I'm a behavioral economist by training. I was like, that's new behavior. Like, we don't have 60-year-old females in like personal strength training gyms and like really killing it. And she was doing the same stuff that I was. Like, we literally did the same movements and the same motions, like side by side, and we became like real good buddies. And then the same year, sitting with friends in Beverly Hills talking about fitness, and my wife said, we do this, this, and that. And everybody said, what are you talking about? And that for me was like the trifecta of like, A, it absolutely works. B, it can help people that don't really have access to fitness today. And last but not least, the largest fitness market in the world doesn't have it. Here we go. So this got me on a short 12-year journey. And absolutely love it every day.
That's awesome. So I obviously know what it is because as we're sitting here, I can feel the soreness in my biceps and my hamstrings from using it this morning and a couple days ago. But real quick, can you just describe what it looks like, how it works, what it feels like, and what it does?
Yes. So electromuscle stimulation is emulating the nerve signals that your brain is sending through your nervous system, through the motor neurons to the muscle to contract. So what these electrical signals basically say is like your brain is telling your muscle to do something specific in a certain intensity, in a certain range of motion, and all of that. And since about 60, 70 years, we know how to emulate these signals. And we can send these through the skin to the muscle directly. And for the muscle, there's no difference. The muscle cannot tell the difference. Does it come through the skin or does it come from the brain? So with this technology, what we can do is we can train muscles. And we've been doing this for 60 years in rehab. So when people get injured, this is the technology that we're using to retrain the muscle after an injury in a local setting. So it is literally the softest and safest way to train a muscle. And what we do is we put this technology into a suit, and you just zip on the suit. You have to prep it for about 3 to 5 minutes, get into the suit. And then we have a content streaming service, which has trainers taking you through 20-minute, 25, 15-minute workouts. So roughly around 20-minute workouts. And they can focus on mobility, they can focus on speed, they can focus on general strength, functional strength, lower body, and so on, so on, so forth. And we pair the right signals to the right muscle groups with the motions that the trainers are showing you in the exercises. And that together is a very, very efficient and very safe full body training methodology where in a short amount of time, you literally train your whole body. There are additional benefits. So you're talking about soreness. We generally have muscles that we really like and exercises that we really like. And then we have others that we never do or don't like. And because the suit covers all the major muscle groups, there's literally no cheating. Like there's nothing that gets left behind. So every workout hits all your major muscle groups. You can say like, I want more here and want less there, but it's always very, very complete. The other aspect that is very interesting is we're using your own body as your counterforce. So you're not lifting any weights. There's no joint loading. And for example, if you do a squat, your biceps, if you do a squat, your quad becomes the counterforce of your hamstring and vice versa. So you always have concentric and eccentric, loads. And you always want this, the positives and the negatives. So a lot of things happen automatically. And I, as the customer who's like going through the workouts, don't really have to care about it. I just need to follow what the trainer is doing, and the system is doing the rest for me.
Yeah, that's great. Yeah, so for me, one of the interesting things is as I'm now an old man, basically, my workouts have changed. I'm in my 40s. So yeah, I'm a joke about being an old man, but I got to a point where if to do as much squatting and deadlifting as I would like to do, to have the body composition that I want and just have the strength that I want, just really having trouble with my low back, like in the joints of my back and hips. Couldn't keep up with like how strong I wanted to be. Same thing with my shoulder, my right rotator cuff. If I do as much bench press or overhead press as I want to do for the amount of muscle I want to have, the more muscle we have, the better, especially as we age. Just, man, we're going to lose it every year if we're not keeping up. It got to the point where my joints couldn't keep up with the muscles, and I would have really a lot of problems in my right shoulder, my low back. And this has solved that for me. I've been able to put on and keep on enough muscle without causing so much strain to those joints. So it's been really, really good. I've really enjoyed that part. And as you mentioned, like I notice it, the soreness in areas where I can't traditionally do the lifts because of whatever pain and injury I have. So it's really, really nice in the way. I do have a selfish question before we get into the scientific questions. The last time we talked, I realized I was definitely doing it wrong. You corrected me because I initially thought, wow, this is a great way to completely have a passive thing. I'll put it on for 20 minutes. I'll do email. I'll be on a phone call. And you're like, no, you need to move through range of motions, which I thought, okay, that makes sense. I have not been able to get myself to really do the entire workout just because from an efficiency standpoint, let me tell you what I've been doing and you tell me how much I'm losing when it comes to the benefit. Like this morning, I did like a 45-minute zone 2 rowing workout. And then after that, I put it on and I wore for 20 minutes on a strength setting and did my normal daily activities at that time. I made a protein shake. I fixed my lunch for the day. I went and woke up my 6-year-old and got her dressed. And it's interesting, like getting a 6-year-old dressed becomes a workout where I'm sweating doing it. And I'm telling myself that I'm moving through the range of motion, walking around, grabbing things, doing things, and that I'm probably getting the same similar benefit as if I was doing what they were telling me on the screen, which is they'll have you do actual movements like an overhead press or different things like that. Am I okay or am I losing a lot when I do it that way?
So I think you're not losing.
Okay.
I think you're gaining. And here is the way I see this. So first of all, I truly do not believe that people only should do one thing. So when people say like, oh, does this like replace everything? Does this replace my waist? Does this replace my cardio? Does this? No, it's like, if you physically can do multiple things in your life, as you did, like go for a rower, do other things, and definitely 100%. The way now is the economist, not the training, the exercise guys talking, like now is the economist talking. You didn't have a dedicated half an hour for strength training this morning. So what you were doing is you were superimposing a training regimen onto your daily routines. So the alternative would not have been not dressing your kids, right? So what you now gained is you gained a, let's say, 70, 80% workout because you also probably didn't go as high because you don't want to drop your kid because like, you're like, oh, like I can't really do this anymore. So you go lighter on yourself and maybe it's just a 60% workout, but you got a 60% workout while you did a regular thing. So you actually gained a lot of benefit in the time where you took care of your family and you took care of like general tasks. So I would say you gained a lot. Is it as much as if you are totally dedicated, absolutely focused on one thing? No, it's not. But the alternative would not have been not dressing your kids. So therefore, I think you gained a lot.
Yeah, and that's what I tell myself. And my experience is occasionally, not very often, if I'm somewhere else, I'm on vacation or I'm traveling and I have plenty of time, I will do a workout with the suit. I'll do burpees, I'll do pull-ups, I'll do different things. And it's a noticeable difference the next day, like the soreness of my hamstrings and glutes and things when I'm trying to do burpees with these. But I've told myself, I love that you use those numbers because I've told myself like I'm getting 70% of the benefit here with none of the extra time. And I just really like getting a workout from doing the dishes. That just seems pretty cool to me. Like I can do the dishes and I'm sweating at the end of it and sore. So that just gives me a nice mental boost.
No, absolutely. 100%. And this is a new tool and everybody will integrate it in their life differently. And I think that's the beauty of it. Like for some, it is the only thing they do. For some, it is truly an add-on. For some, it's the only thing they can do. And like it's a good way how you do it. So you really integrate it into your life.
And I think we didn't really talk about the why, kind of the base why here. And I think because most people that are listening to this already understand, but it's probably worth 2 minutes. Like for me, and I'll let you kind of give your opinion on this too, like the general benefits of maintaining and increasing muscle mass and the overall effect on health and longevity. I alluded to it a little bit earlier, but I want a lot of muscle right now. And it's not from an aesthetic or an ego-based perspective of looking a certain way. I just know the more I have now, I've noticed from when I was 30 till now, it's harder to put muscle on. It's easier to lose it if I don't do things. So from 40 to 50 to 60, it's going to get even harder. So I'm really trying to pack that on, kind of create a savings account for myself now so that I'm losing it more slowly, because when I get to be 80 and 90, I want to be able to do the things that I want to do. So that's the real why for me. I would love to hear your perspective on just muscle mass in general and why you think it's important, how important you think it is.
So let's start personally. So I was a runner. I have like bad knees. I have a bad back. Like my joints, I'm like 6'4". So like my joints are not my friends in general. Like that's never been really my asset. And during my journey over the last 12 years, like my wife and I, when we decided we're going to do this, we also went on a totally different nutrition journey and like really figure out what goes on. And like we were very lucky. So my wife quit her job a year earlier than I did, and she went to a professor. And like a lot of stuff that we're now hearing is like now on Vogue. Like that guy over in Germany was already talking about like 12 years ago, 13 years ago. So it was like really, really interesting. So really building or changing your body composition has happened for me over the last 12 years. And just how much better I feel is just that in itself, like a fully unquantified, absolutely subjective portion. Like I was 180 pounds, about 18% body fat back in the days. Now I'm at like 215, and I'm like 10 to 12, depending on like where I'm in the year and like, something like that. And just everything in life is better when you're stronger. Like literally everything in life is better. Like getting up the stairs, doing things like playing with someone, like doing your sport. Running is harder because you have more to schlep around. Like that's definitely harder, I have to say. But that is so much better. Then the other aspect for me is my whole metabolism, like how much energy I have during the day, what I eat, how much I can eat. I'm just literally I need to feed the beast at this point in time, right? It's just like everything is so nice and everything is so fun. I don't have pain when I move, which I used to have. Like I even feel like my knee stability got up because I have more muscle mass around this. Like, I'm stronger around this. Everything is just much better. And then the other example that I just generally use is in longevity, we always look at it from like what you're losing over time. And I want to come back to this later. But even if you get into a car accident, something that's a freak event in life, the person that packs muscle is like, it's kind of like your armor. It's like, it's not just like punching through. You can stabilize yourself. You can hold yourself. You can do something, and you can probably have a higher survival rate. I would love to see this. I don't know if there are statistics around this, but even things like when you're falling, when you're skipping, when you're, let's say you're like a little bit older and like you have the strength to catch yourself rather than you're just face planting on the floor. Like injuries that then change your life for a negative, for the worse, are just much less likely. So I personally believe that everything in life is better. I even get cheeky questions from like customers who say like, hey, thank you, this got better and this aspect in life got better and that got better. It's like, so people just enjoy life much more. But the input to more muscle mass outside of nutrition, just from a pure exercise perspective, has been difficult and cumbersome and maybe even impossible for people because of previous conditions. And now, once of a sudden, we have a technology that covers the whole body and has no injury risk and takes little time and doesn't need that. So I even would say, and this is what I wanted to come back to, is I don't know if we have to accept the curve going down over time anymore in terms of like your body composition. Because, I mean, we have a lot of customers in any age, and they're gaining at any age. So my question is, when you keep doing it, like, do we actually have to accept sarcopenia and atrophy, and can we just completely eliminate it?
No, and there's multiple studies on this, Bjorn, and you and I both know individual patients. So a couple points, and then we're going to get into the specifics. One of the things you mentioned about more muscle mass will make it a little harder to run. True. However, I also have endurance athletes who are patients of ours, and they're using it. And the thing about them, and they report like, I just feel better. I'm just stronger. Everything's easier. And they don't, and if you're an endurance athlete or a runner, you use this, you're not going to put on a bunch of mass that makes you bulky and slow. It's actually going to improve your performance. You mentioned the trauma and survival. There's multiple studies on this. So there's a study in Frontiers in Medicine looked at skeletal muscle mass and association between hospital stay and things after a trauma, better improvements. Critically ill patients, there's another study looking at cancer survival rates and things. If you got critically ill, muscle mass, big difference. ICU patients, another study, muscle mass and decreased mortality in ICU patients. So there's a lot of studies on that. And when you mentioned I don't know if we have to have a gradual decline. You and I both know a specific patient who did a really interesting thing. 71-year-old decided when I was telling him like, hey, you really should do this Katalyst suit. He wanted to do a real experiment, do an end-of-one experiment. And he got a DEXA scan before and 5 months later, used the suit 2 times a week, did no other resistance training, changed nothing else. We did optimize his protein intake. So that was one variable. But in that 5-month span, as a 71-year-old, you shouldn't really see a lot of muscle gain. At that point, the general thinking is you just want to decrease the decline. Gained 11 pounds of muscle mass, which I didn't believe it when he told me. And then he sent me the DEXA scans. And I'm like, I read it a few times. I was like, no, you're totally right. You did. And that's not science. That's a anecdote, but there is science. There are a few studies, and I don't know them off the top of my head, but I've read them where older patients start a strength training program, not Katalyst specific, but a strength training program, and definitely put on muscle at a similar percentage rate as a younger person. They're starting from a lower point, so it's a lower total amount, but they totally gain. And so
I also read something the other day, is like where I think it was like 3 months ago or something, and the discussion was, can you basically fire up your metabolism and can you get the anabolic response again at a later age? And the answer basically, like, if you're able to put in the work, you can. So it's not that it's like over and over. It's like the question is, can we put in the work? And for many people, that doesn't work, unfortunately. So we need a more accessible training method.
Yeah. So we've spent 20 minutes convincing people who already are convinced they should have more muscle mass. So, but it's fun to talk about. So let's get specific. One of the things that has came up a lot in the last year, especially, is Katalyst suit and GLP-1s. So they're all the rage. People are losing a lot of weight. For obese folks who have really struggled with weight loss, they're a miracle drug. But one of the clear downsides is the loss of muscle mass. And so I've just been, when we put people on GLP-1s at Well Health, frequently we're talking to them about like, look, you've got to do some resistance training. You've got to increase your protein intake. And if you're not definitely going to do a good resistance training program, you got to get a Katalyst suit or do something like that. Do you know if there are any studies on this, or what's your kind of experience around combining GLP-1s and the Katalyst suit?
So in terms of studies, like, I don't know any like very specific ones. We're currently in one together with a clinic chain that is doing weight management in California and the Mayo Clinic. So we're currently in a study where we exactly have multiple groups who try regular resistance training, who try Katalyst in combination with GLP-1 and traditional weight loss management, and have a combination of these methods. We're going to be able to publish end of this year. So we're going to have like much more controlled setups. And we also have like DEXA scan check-ins and like body composition measurements every 2 weeks with, impedance scales and so on and so forth. So there's going to be a much more controlled and larger group study. But what we hear is customers reaching out to us and said, this is what I did the last 6 months, or this is what I did the last 12 months, or this is what I did like over the last year and a half. And the results are just like baffling. It's just, because now what they're not only doing is they're not only shedding weight, they are able to retain their muscle mass. What we generally see is like they still lose muscle mass, but they lose it as a very, very low rate. They lose like, let's say you want to like lose like 30% of body mass. If like 90% of that is body fat rather than muscle mass, you're in good shape because now your ratios like significantly come into place. I think 2 months ago, we started a small show ourselves called Transformations, where we tell the stories of customers that, what have they done, who's their story, what's their life story, and how do we fit into their journey. And his name is David. Like, he's a 2-time cancer survivor, testicular cancer, had like his hormones like totally out of whack, and then he had to take after the chemo, he had to take he took on significant weight. Then at one point in time got on GLP-1, but he also learned from a friend that, hey, you should do this Katalyst thing while you do it. Did it for a year and a half, and now he's like, I think 61, and he has abs, and he's just like, I'm in the shape of my life, and I'm like, in the best place I've ever been. And people ask him like, what is this? Like, what have you done? And the thing for me is we have to get 2 things done in this conversation. One is, and I was a little bit surprised. I think 3 months ago, Oprah did this like special around like the miracle weight loss drug, and there was a section about side effects. And the side effects were generally like, I'm vomiting, or I'm nauseous, or I have constipation, or whatsoever. The loss of muscle mass was not a topic.
Huh.
And I think that should really be the topic.
Yeah.
So where we come in, and this is what we hear from our customers, is customers don't have to wait until they lost some weight to go to the gym. They can start it together with the weight loss management, because now you're not first losing your muscle mass and trying to rebuild it, but literally like you can combine these and reduce the atrophy effect that you're going to have to a large extent. So multiple of our customers are telling us we cannot market it this way, we don't market it this way, and we didn't know about it, but it's going to be the norm. I think it's going to be absolutely the norm, because training methods for people that are 30 plus BMI, what is that? Like, there is not a lot.
Yeah, it was difficult when people haven't worked out for a long time, which a lot of these people haven't. There's a lot of risk to starting workout, and they need to do it. Like the risk of not working out is higher than the risk of doing it. But when you're easing someone back into it, I think it is a pretty safe alternative compared to trying squats and deadlifts and compound movements that you just don't have the form for. So it's a good gateway. So just to summarize this, though, because I want to be kind of scientific and evidence-based, there's not really great evidence right now. Sounds like there's a study ongoing that you all are doing. But for me, like when there's a lack of evidence, that just means as a clinician, I've got to use some common sense. And so to me, I have a hard time finding someone who I wouldn't recommend a Katalyst to who's on a GLP-1. But I would love to get the actual studies. I'm excited to see that when it comes out.
Hey, in 6 months, let's have another one, and let's actually go through it and take it apart and like, just like really, really dive into it, like what we found, because I'm going to be, I'm really looking forward to that, because the harder the evidence, the better. Like this is where I want to go.
And I'm feeling a little sheepish right now because I love the Katalyst so much. I feel like this is turning into like a commercial. So I want to talk just for a second before we dive back into any downsides and things, because one of the things personally I found when I first got it, which I think is probably like a cautionary tale a little bit, is when I first got it, I always feel like anything worth doing is worth overdoing. So I was doing, when I first started, a couple workouts a day until you kind of corrected me. And then when you corrected me, I realized, oh yeah, I feel like crap right now. I am overdoing it, because I had this mentality around this works, so I'll keep doing them. But I also had this mentality around like, this is not like my normal workouts. I'm used to going hard. I'm just kind of standing around. I'm not doing much here. And so I didn't look at it as like a real intense stimulus. So thinking I should do higher volume. And since then, I've really backed off. So could you talk a little bit about overtraining and how not to do that, or if any other risks or issues you found?
So doing more a day, as long as you don't really start right away with it, that is not as bad as doing it every day. So let's say if you had like 2 workouts a day, or like you spend like an hour a day in the suit, which is like you do a strength training of 20 minutes and then you do an add-on of like 10, like we have like lower body add-ons or like ab add-ons and whatsoever, and then you spend another 20 minutes in doing cardio, that would be the equivalent of you spending 3 hours in the gym. Yes, people who spend 3 hours in the gym exist, and you shouldn't do it, I think, because of your cortisol levels and so on and so forth. You should definitely split it up. But it exists. Ease yourself into it, definitely. The second thing is, and that's the more important piece, is give your time to recovery. Give yourself time to recover. That's really, really important. So we say at least 48 hours or 2 nights between sessions. When you start and get into it, make it 3. If you don't feel about it, make it the 4th day. It's totally fine. It is absolutely good enough. But I also have to tell you, is like the number of patients that are overdoing it is low. It's like people have generally a good idea. Like, so here's the thing, like the type A go-getters don't start from 0 because they have been doing something else before. They are not completely unexperienced. Like, so people that are mentally in a state where they have a certain amount of discipline in their life, they also have a certain amount of discipline about exercise, workout, and so on and so forth. They are not starting physically from 0 or from no experience in fitness. So for those people, it is, you're probably overdoing it. You're like, feel like crap whatsoever, but not to a point that is actually dangerous or difficult. The people that have no experience, we have a group of about 15% of customers that are underdoing it. Like they're so careful, they're like so afraid. And I always find that interesting because, if, and there's a similar thing in nutrition, right? So if you eat like 15, I don't know, what are these like birds called? Like then in America, like these like sugary, like absolute nuclear bombs. Like if you eat 15 of these, like no one is like, calling you out. If I order 2 pounds of steak in a restaurant, people say like, "Oh, you want to die?" Like, or whatsoever. It's like, no, it's like, I'm not going to die off this, right? So I find this always very interesting. So we are actually afraid of overdoing it. So this is why some people don't do it. Those people who overdo it, we've never seen like real side effects. We've never seen any of that. There's no injury risk. You could definitely optimize it and do that. The one thing that I wanted to discuss with you in this area is interesting because it's also new for a lot of physicians, and that is certain biomarkers and blood markers. So we had customers doing their first, second, third workout, especially at the beginning, starting with Katalyst, and they just happened to get a blood draw. And actually, a friend of mine, like he was at the airport in San Francisco, and his physician calls him and says, "How are you feeling?" And he said, "I'm feeling amazing. Like, I'm just boarding the plane to Shanghai. Like, I feel amazing." And he said, like, "I just got your blood back. Like, it looks like you're close to a heart attack." And he's like, "What are you talking about?" It's like, so your creatine kinase levels, like your CK levels, are very, very high. And maybe you can talk a little bit, like, explain like even better than I do, like, what that is and what that's coming from. And people are basically drawing the conclusion, like you have like high levels of rhabdo, you either have a heart failure or like you had a car accident and massive trauma and you must be bleeding, peeing blood. But that's not the case. It's just a sign of there is muscle damage, which we wanted to inflict to replace it with better muscle mass, especially around newcomers to the training who haven't been training for a long time. So there's a lot of bad muscle mass that needs to be circulated out and like refreshed. Yeah, I don't know. Have you seen high CK levels with your patients?
So we have because we don't really test CK levels that much in the emergency department. I mean, when I was an ER doctor, like we would see patients with elevated CK levels, and like you said, it's just breakdown of muscle. And so for me, at least, again, not having seen this a lot, if I see someone that had elevated CK level or things like that, and they're good, feel totally fine, look totally fine, I don't really care. I may measure a creatine level to see what their kidney function is. If it's affecting their kidneys, okay, that's an issue. We need to slow things down. But when we would see a patient that had fallen and has just been laying on the floor for a day and they have elevated CK levels, that's a concern.
That's difficult.
You shouldn't be getting muscle breakdown from that. But the point of exercise is to cause some skeletal muscle damage and things. And I've seen studies of like marathon runners and others. And like when they do measure these things post an intense workout like that, they're elevated. They're just always elevated. And we know that's part of the process. So yeah, it's interesting. I can certainly see how a regular internist or family medicine doctor would be concerned about this because it's new and they haven't seen it, but it's probably just because they're not checking CK levels post intense exercise with folks. So it's not something I would be super concerned about.
We went through the same cycle in Europe about 10, 12 years ago. So when EMS training came up, once of a sudden, individuals that when you as a doctor like see them walk through the door wouldn't say this is an extreme athlete or this is a like marathon runner whatsoever. And creatine kinase levels are like much more common to be checked in blood work over there. And they were like, what, like, they were just like, oh, what's going on? And then they found the commonality as like EMS studios just became so popular over in especially at Germany first, and then Europe in general. I mean, Germany alone has like 1,500 EMS studios, like we're the size of California. So it just became so normal. There are like now a bunch of studies where they also like there were never any side effects. There were no renal function problems, like nothing like that. It is one marker, but it's not if this, then you have rhabdo. That's not what it is.
Yeah, there was a I remember seeing I'll have to look it up, but I remember seeing a specific study in marathon runners where they drew their blood levels, and if I remember correctly, almost every single one had elevated CK levels, and about 50% had elevated troponin levels, which would make me a little more worried if I saw that, just as a past emergency medicine doctor. But again, I mean, you took the Chicago Marathon, there's 40,000 people there. Like, what percentage of them are having heart attacks or a bad outcome from the troponin CK? They're not. So it's not the CK itself, just knowing that in marathon running studies, nearly everyone has an elevation. It's not something that if you're a physician listening to this and you have a patient post-Katalyst that has the elevated CK, or you're a patient and your physician calls you, I don't see that as something to worry about. Maybe check a creatine level if you're concerned, make sure your kidney function is okay, but that's all I would do there.
Yeah. That's what we're saying is, but sometimes like people are really calling us like, oh, like my doctor said I have rhabdo. I'm like, yeah, then my question is like, are you peeing like brown? No. It's like, okay, you're fine. Like that's generally what it is. And then as you said, like, it's like check creatine levels. It is, it is new.
Rhabdo by definition is a constellation of things. It's not just an elevated CK. So it's an important point to make. I will say, I brought this up as an issue for me. I think I'm clearly an edge case. I think the mistake that I made was underestimating the efficacy and the stimulus that this gives you. I didn't change any of my normal workouts. I just added this and would do twice a day. And I have more respect for it about the actual stimulus that you're getting. And I never do it. Obviously, I never do more than one a day. I never do more. I never do 2 days in a row. I always have at least a day between now that I've learned. So I would recommend that people to not do it back-to-back days.
How good is that? Like you just said, like, I underestimated the efficacy of a good thing. Like, hey, like how often do we have something like this? And this was really like when I said earlier, I was training beside this like 6-year-old female. Well, I was like, this is almost too good to be true. And I think this is like partially a challenge for us. So people have been oversold for so many time of like fitness things that did not work. And and here's something that like, hey, don't do too much of it. It's like,
I used to not, when I first started, I did not count it as a workout. And now I do. Some days I will only do that. And I still usually pair it like post something else, like a zone 2 or something else like that. But sometimes I do it by itself.
But you said something interesting. So you said you first did 40 minutes of rowing and then you did Katalyst.
Yeah.
So how are you guys recommending sequencing strength training and cardio training? Because what I traditionally heard, like maybe that's outdated, and would love to hear your opinion here, is like start, like, of course, do a warm up, but start with a strength training when your glycogen levels are still high and like your muscles like still have something to work. And then if you want to go into zone 2, you actually go into like aerobic, exercise and have to do this, right? Rather than like burning off the glycogen in the first 15 minutes of your cardio.
Yep. So that's a great question. So I'll tell you exactly why I do it in that order, because traditionally and historically, if I was going to do an endurance and a strength workout, 100%, what I would advise and what I would do is just strength workout first, because for a couple reasons. If I do the endurance thing at first, I'm going to be fatigued enough to where I'm not going to get the same strength workout from lifting weights. Whereas if I do the strength training first and I go do the cardio, the pre-fatigue actually just gets me into zone 2 a little more quickly. And I don't have to do as intense a workout. However, I look at it very different with the Katalyst. Because the Katalyst is more passive to me, I'm not worried about the endurance work, meaning I don't get as good a workout, because I'm going to get the same EMS stimulation post-endurance or pre-endurance, either way. So because of that, I'm less concerned about doing it first and the endurance later, because I think of the two of like how they affect each other. And the fact that, the level that the EMS goes up to and how much I'm moving is not going to change whether I do the endurance before or after. I feel like the total stimulus is actually more if I do endurance and then strength. Where if I did the EMS suit first and then did the zone 2, it's a pretty good stimulus, that Katalyst suit. And I may have some muscle fatigue and like just not do as intense of a cardio workout. So the total stimulus, I feel, for me is more when I do the Katalyst second. And just from an efficiency standpoint, post-workout, I'm usually fixing my protein shake, I'm getting things ready, fixing the lunch. And so efficiency, and that's why I time it out and sequence it that way.
Hey, and you can't dress your daughter on the rower. That doesn't work.
Yeah. Well, and my kids usually aren't work. I'm usually doing the endurance thing before they're up. And so that's so it's partly theory and why I do them that order, and partly just for my life and how it works.
Yeah, because in our workouts, we recommend like, hey, if you only have short amount of time, do a strength or power workout, like focus on that. And if you want to add cardio, like we add it afterwards, which also has like a lactose acid flush out, and, a nice like pre-active recovery, like basically an active recovery effect. So that's generally what we are recommending. And I just wanted to check if like maybe I was wrong.
Well, and when I sequence Katalyst, I'll do the strength first and the endurance after. But when I'm on having to push the weights around or push the endurance, I do the one where I've got to put the mental effort in. I do that first, where I'm fresher, and then I let Katalyst finish me off afterwards. So one very specific thing that I wanted to ask about, because it's a question we get a lot, is around women's pelvic floor and bone density. Funny story, last week I was with some friends. We were rafting the Rogue River in Oregon. There's 4 families. And I found myself in the evening sitting around talking, and all 4 of the wives from the family were there talking. And all of a sudden the conversation turned to pelvic floor issues. And 2 things I noted. One, all 4 of them were talking about these issues they had, and these were not old. They were all in their early 40s, I believe. And I was surprised all 4 had experienced some of these issues. The other thing I noted is like, why am I in this conversation? And so I felt a little uncomfortable when I got up and left cut the conversation because there was a woman physician in the conversation. Like, I don't really have a whole lot to add to this, so I'm going to just let you guys talk about it. So at the risk of 2 guys mansplaining this, is there what data is there on pelvic floor issues at Katalyst, because Katalyst came up in that conversation, and it was really interesting to hear them because they had experience with Katalyst. These women who were talking, and so love to hear any data.
So I was in the same boat as you were, like, what is a man here doing there? But actually, the conference that we both spoke at last November in Florida was a pure female oriented, health conference, and like this is where we met the individual that we were talking about. So I think, and I actually asked some of them, is like ladies, like, how is it for you, like, men trying to, like, discuss these topics with you, and what I got back was actually very beautiful. They said, like, we love that you guys care. And that was like a really, really interesting way. So I have only received positive feedback and surprise and delight when diving into these issues and caring about these issues. And over the last years, I developed quite a passion for that. And as I said, it's like I trained beside a 6-year-old female at the beginning, and like I was like, okay, great. If I can help that audience, that's like absolutely amazing. So there's a bunch of aspects here.
And so one thing I'll say about that, me walking away from that conversation, one of the women in the conversation was an OBGYN who had experience with Katalyst.
That was covered.
So I was totally like, covered. I think you guys got this. Yeah,
you got this, right?
I'm gonna go play with the kids.
No, but like to the point of, like, is it mansplaining? Is it bad? Is it negative? It's like, I've not heard that yet. And I just got positive feedback on this. So a few things. The pelvic floor is part of your core, your lower core, and it's like generally very, very hard to train. So in Katalyst, what we have is we have pads on the right glute and the left glute, and on the right hamstring and the left hamstring, and on the right quad and the left quad. And the current flow is actually flowing through that area because they coordinate with each other. So especially if you do, like, let's say, sumo squats or very deep squats or whatsoever, is like, especially the men in the first place, they're like, because they never really have like an active connection with this. Women are trying to train their pelvic floor. Men have a little bit like, yeah, it's there, but like, something hangs out of it, and that's like pretty much it. They were like, oh, like, does it actually train that, or like it's weird, or like, it's tingly, or like, it's going there. So the system is actually helping you find those muscles, engage those muscles, and learn how to connect with them. The first side effect that I heard from customers very, very early on with full body EMS training and Katalyst in specific, how we have placed these electrodes, is women tell me they got over their postpartum incontinence. So they always have an issue, like especially like fit and active people, when they do plyos and whatsoever, there's always a drop coming here and there, totally gone. So their ability to engage their core and overcome postpartum incontinence is a massive quality of life addition for women. The benefit, we tell people 6 weeks after, or women 6 weeks after giving birth and having your baby, you can start with Katalyst again. And the recovery of your abs, of your pelvic floor, of your general core overall is so beneficial because it really rebuilds the strength of this area after you carried your baby around for 9 months, and really, really rebuilding that. So absolutely beneficial. Before, it is specifically beneficial for women because when they have a stronger core, your back pain from carrying the extra weight and having that extra mass around your core is not as much as an impact because your core is stronger, your back is stronger, you can like actually carry that. So there's benefits before having a baby and after having a baby, definitely. In terms of bone density, this is something that I would have not thought would have an impact, but especially women, because of their hormonal composition, like have much more issues with osteoporosis and osteopenia than men have. About, I think, 10 years ago, a group in Germany where EMS training has been around for quite some time, and like the universities are study this, like there's new studies coming out every year. They took 76, let me just like be clear here, like 76 lean sedentary women at 75 years of age, plus minus, I think 3-4 years or something like that. And they put them through 1 year of either EMS training or the semi-activity that they have been doing for that time. The EMS group did 6 workouts a month. So 1.5 a week, regular EMS workout. So again, DEXA scan, x-rays, before and after, lumbar spine and femoral neck. And the control group lost a little bit more than 0.5% of bone mineralization over that year, which is about normal sarcopenia, osteoporosis at that age. The group that did EMS training gained 0.5% on average in bone mineralization. And this is so crazy because the traditional wisdom had it, you have to heavily load. Like you have to load your spine and your neck and whatsoever to like have the bone cells be active, but you can actually not reverse osteoporosis. So I would love to like also run a study around this. Maybe like the guys at Mayo or somewhere else are interested in like really confirm that and really dig deeper. Because if that is true and really holds up, and it looks like it because it was not a small group and it was like done in Nuremberg at the university clinic there, we would not be able to reverse sarcopenia, so we can get people muscle mass again, but we would also be able to get people bone density again. And that would be absolutely beautiful.
That's great. Yeah, I mean, it would be, the more studies on that, the better. I mean, bone mineral density is a real issue as all of us age, especially women. But I'll say also as a business tip for you, if you wanted to do the study on pelvic floor strengthening, I mean, most people, when we think of pelvic floor, we think of Kegel exercises, and there's a fair amount of evidence on it for improving, as you mentioned, urinary continence, but also sexual function and blood flow and orgasm. And so if you could do a study showing the Katalyst suit improves sexual function, there you go. I think you've got something that'd be an interesting study to do.
Yes, I think that's, yeah. So, but that was I hinted to that a little bit earlier today, where I said, like, customers are telling me, like, does that change, or does it get better, or does this get better? It's like, and it goes both ways. It goes for men and women. So, ED goes down. Yeah. I don't know where we're publishing this, if we're okay to talk about this, but I can tell you it's everything feels different on both sides. A stronger pelvic floor is a really, really beautiful thing.
Yeah, we'll leave it at that. A really beautiful thing. So, Bjoern, as we're kind of running out of time, are there any other specific? We've talked about how aging population who you really want to preserve or add muscle mass. We talked about pelvic floor. We talked about a few other specific cases, like myself with some joint issues, and I want to maintain muscle mass without wearing those joints out more. Are there any other specific populations that you think this device really shines for, or any that shouldn't use it as well? I think that's just as important.
Yeah. So from a contraindications, let's start there for a second. It's like, unfortunately, we cannot work with individuals that, for example, have a pacemaker. Because the signal trips the pacemaker into thinking there's a misfire, and then it misfires. It doesn't fry the pacemaker, but it basically, there's like so much signal and noise within it, and the pacemaker doesn't know how to deal with it. I don't know if like maybe in 10 years or so, we have pacemakers that can understand that. And maybe we should even work with the companies. It's actually a cool idea. And see if we can do that. But the population is also relatively small. I mean, the pacemaker population is pretty small. But I literally have an employee whose mother, and he's a trainer at Katalyst, and he would love to give it to his mother, but his mother has a pacemaker, so he can't. So it's actually a thing. Other than that,
With the
while
pacemaker,
you're pregnant,
Bjorn, can you do the specific? Like, could you do just the legs only, or just the biceps only, or just kind of too much risk there in general?
so I think it's so the pacemaker companies, they basically have, don't do this, don't do this, don't do that. That's not even on us. It's similar to, don't go through the metal detector and then you probably void the warranty of your pacemaker. And I don't want to be in that. That's not my, sorry, like I've got to stay very, very far away from that. We're not going to do that. But yeah, I mean, theoretically, probably there is something around here. So at the end of the day, and this is the mind-blowing thing for me still, is it's almost for everyone. It really doesn't matter. So whoever calls us like, oh, do you have my size? And, oh, I have this, and I lost my hand in a car accident, or I have people in wheelchairs, or it's like, I got blown up in overseas, and like, I want to train with this. It's like, it's literally, if you have muscles and you don't have a pacemaker and you're not currently pregnant, this is for you. And the use case might be very different. It might be for you, like, you're already fit, you're already doing something, you put this on top. Or we're currently talking to trainers of like pro athletes and overseas, and they say like, yeah, we already use this, but this is better because I can travel with it. So it's literally, so easy. I just talked to a friend of mine, like he's a trainer in Hollywood, and he says like, yeah, of course I can train people, but once they leave and they go on set and they go around with, what do I do them? Like, what do I give them? Like, how do I maintain them? I give them a Katalyst. Like, they don't have time. They don't do this. I have commercial airline pilots who just put it in their carry-on, have it in the hotel in Tokyo, like do their workout and come back. It's just so wide and so broad. And I truly believe, and I think I mentioned this in the last podcast, is like, it's this electric toothbrush moment where, who's an electric toothbrush for? It's not for men or for women or for elderly or for people who are blonde, or like, that's not the thing. It's for people with teeth, right? That's literally what it is. Like, electric toothbrush. And I don't know anyone who doesn't have electric toothbrush at this point in time. It's like, and we're buying like the 8-pack at Costco. I think what we found here and what we've productized in a usable way is a training methodology for people with muscles. That's literally what it is. And as you said, and we both like discussed it at the beginning of this episode, muscle mass is so important. And now what we have is, you're spending $100 a month, and let's say 3 to 4 hours a month, and you're going to be in better shape. You're going to be in better health. You're going to have more fun in life. You have basically no side effects. You have less risk of dying. Like, why not, right? So like, no one has the discussion anymore, am I going to get electric toothbrush? It's a question, which electric toothbrush am I going to get? Like there's no discussion if I'm going to get an electric toothbrush. And I think in 5 to 10 years, it's the question of which one do you have? Like, which phone do you have? Which TV do you have? Which electric toothbrush do you have? It's not, do you have a phone? Yeah, this was a discussion 20 years ago, but not anymore. And I was ridiculed when I had my first mobile phone in the 90s, right? But it's I think it's going to become an absolute normal thing.
Yeah. It's I can't get this image out of my head when you said it's contraindicated in pregnancy. I imagine these little babies coming out super jacked. It was like, yeah, you don't want these super, but I don't think that's why you said it's contraindicated. So
no.
Yeah.
The other thing is, like, it's a good point. Like, let me just like highlight this really quickly. So in the US, we are only cleared for 18 plus, only cleared for adults.
Okay.
So technically, you could argue like a 14-year-old should not heavily lift because their bones are not set yet. So they shouldn't heavyweight lift. Might actually be a good thing, but we're not cleared for minors, so please don't do that.
Yeah, gotcha. So, to be fair, like we talk about who is it not for too, one of the issues is this is not free. It's not cheap.
No. Yes.
There is, this is a device. It's a pretty high-tech device, so there's significant cost. So the last thing I guess I'll ask you, and I should have talked about this before we started recording, but are there any discount codes, or are there anything like that? I believe we have one for Wild Health patients.
Yes, we have one. I actually don't know on top of my head what the discount code is. We're going to put it down in the show notes. Like, there's the link. There's definitely a discount code. But here are like two additional things that I would highlight. One is we have a firm financing, so that makes it like, shipped out. But also we have a partnership with a company called TrueMed, so you can use your HSA and FSA funds to pay for it as a medical device. So if you like stack those up, like take the Wild Health podcast discount code, put some of your FSA funds in there, and I don't know what else you would be using them for, like, because sometimes they run out at the end of the year, and do something with them. And then if you want to finance it, I think we can bring down the burden quite a bit.
Okay, great. So yeah, I'm embarrassed that I don't know the code either, but we'll put that in the show notes. So you're saying the code FSA, and then there's also financing available. So it's more of a monthly gym membership type thing than a big out-of-pocket expense.
Yes,
okay,
definitely. And currently we actually even run like a site-wide sale on the suit, because we really want to make that not the issue of people getting healthy and in shape.
Awesome. I'm sure we're going to have a lot more questions from this. If we do, what I may do is run them by you, and then we maybe even do a couple of social media posts too, answering those. And but this is really helpful. I really appreciate you coming on again. I use this every other day myself. I'm constantly talking to people about it. So I'm just excited for more and more people to be able to get this and just lower the barrier to improving fitness and gaining muscle, because it's important. And I think we've made that point pretty clear. So anything else, Bjoern, before we go that we didn't cover?
Not at this time. What I would say is, like, let's meet again after this study is done, and then dive into that and cover even more questions. Matt, thanks for having me.
And we'll do a sexual health podcast only and get tons of views from that. Everybody's excited about that. So
I'm actually just in an hour, I'm on with a female postmenopausal hormone expert and doctor, and we're just actually going to cover a lot of these aspects, and maybe one time we do a podcast with the three of us.
That'd be great, not just two dudes talking about it. So that'd be wonderful.
Yeah, exactly. Let's make this a little bit more relevant.
Yeah. Awesome. Thanks so much. Talk to you soon.
Take care. Thank you. Bye.
Thanks so much for listening to the Wild Health Podcast. If you're a Wild Health patient, you might not know, but you have access to our referral program. This gets your friends and family 25% off Wild Health services. Just head to Clarity, and in the top right corner, you'll see Refer a Friend. Click there, and you'll be brought to a page with your referral code. Happy sharing.